Welcome back. The Africa Workforce Investment Forum kicked off in Windhoek earlier today. The three-day forum is jointly held by the Namibian government as well as the World Health Organization. Although there have been some strides towards establishing a resilient and robust healthcare system in some African countries, substantial progress is lacking in terms of ensuring an adequate and fair distribution of healthcare workers regionally and nationally. Joining us for an in-depth discussion is the Executive Director in the Ministry of Health and Social Services, Mr. Ben Nangombe. Mr. Nangombe, good evening and welcome to the show.
Good evening, NDC. How are you this evening?
We are good, thank you, sir. How are you?
I'm doing very well. Thank you very much.
Mr. Nangombe, I want to start by talking about what the main goals and objectives of the Africa Health Workforce Investment Forum are and how this event contributes to addressing health workforce challenges in Africa.
Yeah, basically, the Africa Health Work Investment Forum, and it's the first of its kind. Namibia was requested by the WHO to host this particular forum, and the objective is to bring partners in health together in order to find ways and means by which more resources can be mobilized, more strategies can be put in place to ensure that Africa has adequate human resources to deal with the disease burden that the continent faces. It has been found that Africa has a shortage of health workers amounting to about 6.1 million. And this affects the quality of care, it affects the availability of services, it affects the implementation of interventions that are aimed at promoting good health across the continent. Of course, the situation is slightly different from country to country. There are countries that are doing better than others. There are countries that are in dire straits. Now the question is to say we need to find a common approach to investing in health. We need to mobilize development cooperation partners to support us more according to the needs of Africa, according to the priorities of Africa. So that is why this meeting is being held. Namibia is hosting it. We were requested to do so when the request came in from WHO, the Ministry of Health and Social Services, of course, approached Cabinet. Cabinet approved that we can indeed go ahead and host this meeting. So we have more than 170 delegates here, and the deliberations have been going well. We have been at the Mercure Hotel since morning time. We are still here engaging in the discussions. I think what it basically means is that the proposals that are being made, the strategies that are being put forward, will culminate in what is being called as the Africa Health Workforce Charter. And this charter basically obliges government or requests government to put certain measures in place on how the question of the deficiency in the availability of human resources for health is concerned, is going to be dealt with. So this is going to be a game changer in a way that African governments and the development cooperation partners are going to have a common approach in the way in which we deal with the issues of human resources for health on the continent, to mobilize more resources, to strengthen public health care system, to avail health services, and thereby have what we call improved health outcomes for the individuals who come to our health facilities. We know that during COVID, there was a situation where our healthcare workers were experiencing burnout because they were working long hours, dealing with an inordinate number of patients because of the COVID-19 infections, and this is what basically spurred us on to be able to say we need to have a dedicated approach to changing the status quo and making sure that more and more human resources are made available across different disciplines of the health sector.
Mr. Ngombe, you mentioned that the figure is 6.1 million healthcare workers lacking in Africa. That is no small number. Is this the only major challenge currently facing Africa in strengthening the health workforce, or are there other challenges as well?
I think human resources is just one. You see, in order to deliver healthcare services, you need feet on the ground. You need people. You need the doctors and the nurses and the physiotherapists and the pharmacists and the cleaners and others. But the issue must be taken as a complete package. So as much as we are trying to address the question of the shortage of human resources for health, we need to make sure that there is access, or the health facilities are in good working order, that the hospitals are properly maintained, that they are fit for use. We must have the necessary equipment in these hospitals. We need to have the ambulances. We need to have the diagnostic equipment. We need to have the pharmaceuticals. We need to have the clinical supplies. It's a whole package. So basically, yes, health, human resources for health, but we must look at the broader package of what is required to provide a robust, responsive healthcare services for the African people. And this is in line with the Sustainable Development Goals that deal with the matters of health, such as Sustainable Development Goal 3. It is in line with our response and approach towards the achievement of universal health coverage, which basically means that the people of Africa must be able to have access to the health care that they require at any time and wherever they need them, so that people don't have to suffer what is known as financial catastrophe in accessing public health care services. So that is the starting point in terms of what needs to be done to strengthen public health care services on the continent.
How does the hosting of this investment forum promote collaboration and knowledge sharing among different countries and organizations, Mr. Ngombe?
I think what we are learning here, as I said, we have delegations from different countries in Africa, about 47 countries. We have about 170 participants. Each and every delegate that is coming is sharing best practices from their own country. So in Namibia, for example, we are saying what we have done in terms of having data on healthcare workers. We have an integrated human resources for health information system. This data set, this system, what it allows us to do is to produce on an annual basis a human resources for health status report. And that human resource for health status report talks about the numbers and the deployment of different categories of healthcare workers, both in government and in the private sector. So it is something that other countries can learn from. We are learning also from other countries in terms of what is it that they are doing to make sure that the healthcare workers in their countries are better resourced, are better remunerated, and are better motivated. We know that, for example, in Namibia here, we find instances of situations where clients and patients who go to our health facilities complain that they receive less than adequate care and services from the healthcare professionals. The question is, how best can we motivate our healthcare workers to be more compassionate, to be more dedicated to their work? And we are not saying this is true for everybody. It's true for certain individuals. It's not something that is necessarily across the system, but we need to make sure that we have to learn these lessons. We need to apply these lessons so that we improve the public healthcare system overall. And that is why it is so important, because whether people are coming from North Africa, West Africa, East Africa, each and every one of them has got a story to tell. And we made sure that during the program, specifically, we allowed delegations to speak up. We allowed delegations to share. And this is going to be recorded. It is going to be synthesized and made part of the interventions and part of the provisions of the investment charter that we are going to launch, because this is going to be a guiding document, and we believe that it is going to make a whole lot more of a difference in terms of improving healthcare services on the continent.
Mm-hmm. Mr. Ngombe, what was the international stakeholders or partners' perceptions of, the healthcare sector in Africa, particularly in Namibia?
I think there are areas where Namibia is doing very well. We have received commendations from many of the delegates. As you may have heard, this Africa Human Resource for Health Investment Forum is coinciding with an award that Namibia received for being on the path to elimination of HIV and HIV/AIDS from the mothers to their unborn babies. So we are on the path to eliminate the vertical transmission from mother to child of HIV. We are on the path to elimination of mother to child transmission of the hepatitis B virus. So that means that 98%, 98 babies out of 100 babies born to mothers who are HIV positive in Namibia, the babies are born HIV negative. So you remember that in the past, the situation was if the mother is HIV positive, the child is born HIV positive. Mm-hmm. That is no longer the situation. We now have a situation where even if a mother is HIV positive, when they give birth to a child, that child is HIV negative, is HIV free, and they don't have to live with this infection and with this disease. Mm-hmm. So, and that is a function of the interventions that we have made as a government, as a ministry, in terms of improving public health care services. So it means these children are going to be born healthy. They are going to be without the HIV positive, without the HIV virus, without the hepatitis B virus. Again, the prevention of the hepatitis B virus is again through the interventions such as a vaccination that the government carries out. It's a function of us having these programs, requesting, for example, our healthcare workers to make sure that each and every mother who comes to the hospital and attends antenatal care are provided with the education, are tested. If they are HIV positive, they are initiated on treatment, and if they are initiated on treatment, it means that they will become virally suppressed. If they are virally suppressed, it means that they are not able to pass on the virus to their unborn babies. They are not able to pass on the virus to their partners. Mm-hmm. Because, again, you remember, in February 2023, Namibia also received an award from Ambassador Kenkasong. This is the ambassador responsible for the management or the administration of PEPFAR, the program by the government of the United States, whereby Namibia is supported to strengthen our interventions for the prevention of HIV. And on this, we have on the UNAIDS 95 cascade, Namibia has done very well. That is why we received this recognition. And again, we are saying through these interventions, Namibia is actually moving towards ending AIDS as a public health threat by 2030. What does that mean? It means that by 2030, we are going to have significantly reduced the number of new infections of HIV. We are going to have reduced significantly the number of people dying because of AIDS-related ailments.
Mm-hmm. Well, that's a great milestone, Mr. Ngombe. Indeed, the government and the ministry needs to be applauded for all its efforts in that regard. Just lastly, sir, before I let you go, how do you envision sustaining the momentum and commitments generated during this event?
Yeah, this is exactly, this is very important element, because we are saying we need to have sustainability. And that is why we are saying when the development cooperation partners come to our countries to support our programs, they must do so based on our priorities. With respect to the investment charter, we are saying there must be mechanism built in within the investment charter whereby the countries can hold each other responsible, where we must be able to report on a periodic basis to say that, yes, when we have signed onto the investment charter for the investment in Africa's healthcare workforce, we must be able to demonstrate that, yes, we are living up to the commitments that we have made. For example, you have the Abuja Declaration, where it obliges African governments to invest not less than 15% on their national budgets in the health sector. Namibia has, over the past few years, for the past 6 years, we have demonstrated that we are able, and we have the commitment, and we have in fact invested or allocated more than 15%. We have gone beyond the Abuja target, the Abuja Declaration target of allocating 15% and more of the national budget to the health sector. So these are some of the measures that are going to be articulated and encapsulated in the investment charter, and we are going to be obliged to report on a periodic basis showing that, yes, we are living up to these commitments, we are making progress towards the achievement of the targets, and that is, I think, it's a new way of doing things that is going to oblige African governments to be able to report and thereby strengthen the public healthcare system on the continent, and we believe that this is going to make a difference and strengthen our health systems.
Mr. Ben Nangombe, we thank you for your time this evening. Thank you so much for joining us.
You're most welcome.
That was Executive Director in the Ministry of Health, Ben Nangombe, speaking to us about the Africa Health Workforce Investment Forum, which kicked off in Windhoek today. We'll be right back after this.